We'll meet sitting on true love. We'll meet sitting here. I've just returned from the salt sea, and it's all for the love of me. Come in, my old true love. In heaven, seat with me. It's been 3/4 of a long, long year since together we have been. I can't come in, no, I can't come in, I can't sit down. For I haven't but a moment's time. Here they say you are married to a house carpenter, and your heart will never be mine. Yet I could marry king's daughter dear, and I'm sure she'd have married me, but I've forsaken her crowns of gold, and it's all for love of me. Yeah, will you forsaken your house carpenter?
Welcome to Clarksville, Arkansas. With a population of 9,524, Clarksville is the mecca of Johnson County. The median household income for Clarksville is $31,000, almost $10,000 below the Arkansas average. Over 24% of the residents are under the poverty line, and over 15% of residents are over the age of 65. We started this project with the intent of exposing the difference in healthcare outcomes for geriatric patients in rural versus urban settings. However, after speaking with these patients, we began to realize the unique struggles each has to face to obtain the same quality of healthcare that we have come to expect here at UAMS. While the majority of us will not practice in a rural setting, as providers we must realize that each of us will have patients from either rural settings or rural backgrounds. We owe it to these patients to understand the challenges that are unique to them. Clarksville is over 100 miles from UAMS and can take 2 hours of driving to get there. Patients from Clarksville must set aside entire days to travel to us. Aside from just leaving their homes, these patients and their families must take time off work, book hotel rooms, and adapt to unfamiliar settings. This is especially difficult in geriatric patients, many of whom rely on others for transportation. The patient per provider average for Johnson County is 1,620 to 1. It is our hope that this project will be used by fellow medical students and providers as more than just an interesting look into the lives of geriatric patients in rural areas. Instead, we hope this project will serve as a direct insight into the backgrounds and the mindsets of these patients. We understand that rural patients are commonly seen as difficult, but we hope this project will allow you to understand the difficulties they face seeking your care. Today we will introduce you to Richard and Betty. Richard is an 85-year-old farmer while Betty is an 86-year-old retired nurse. We sat down with each of them to ask their perspective on rural health and how it can be improved. Okay. I was going to ask you, how many times in the past 20 years have you seen a doctor?
Me?
Mm-hmm.
Well, the last 20 years I was in the hospital one time, and before that they asked me who my family physician was. I said, I don't have one. I hadn't been to the doctor in probably 20 years before that. And now then, once you go, it seems like they always have something for you to come back.
Yeah. How many times do you think you've seen a doctor in the past 20-something years?
It'd be hard to count them.
As a young doctor, what's something you'd want me to know before I start my practice?
Well, that we need some help in the rural areas of Arkansas.
Yeah.
That's one of the main objectives that we need to work on.
Yeah.
They need to find out how you live and go from there more.
Oh, that's one question I have is, what would you want doctors to know about you as far as personally before you went forward with care? Would you want them to know more about your background? And
Yeah.
how long do you think, if you needed an ambulance to come out here, how long do you think it would take an ambulance to get here?
Oh, about 20, 25 minutes.
About 20, 25 minutes, and 20 minutes getting back.
Right.
Yeah, so about like a 40 minute trip.
Yeah, 40 to 45.
30 minutes at the very least,
And that's to get here, do you think, and the same getting back?
probably.
Yeah. And, what do you think about whenever you have to go to Little Rock for anything? How do you feel about Little Rock?
Oh, as far as their health, it's fine. You know, I have no problem. I've been there several times. You know, my wife's operations and stuff, and both hospitals seem to be very capable.
Is-
All three of them.
Do you find it troublesome having to go to Little Rock? It being whenever you have to have a specialist, having to go all the way to Little Rock?
Well, I wished it was closer by.
Right.
And if the doctors that we needed to go to would be at Fort Smith, that's where I would go to Fort Smith, because we're half the distance.
How do you think rural health could be improved?
Well, I think the first thing is we need affordable and dependable health care. We need to ensure funding for our rural hospitals. We've got to stay open. If we don't, then we'd have to go to Russellville or go on up further away, and more people would be dying and more people get in worse shape. The doctors in rural areas are overworked. Here in Clarksville, they're just worked all the time. I don't see how they can keep up with it.
How do you think that healthcare could be improved in the rural area?
More doctors, well, in the way of more specialists instead of just family practice.
How long do you think, if you wanted to go and get a doctor's appointment right now to get one in this area, how long would it take to get in to see the doctor?
Well, if it wasn't an emergency, you'd probably talk about two weeks, something like that. Now, if it's emergency, then they'll work you in, but if you just going to see the doctor, you'd probably be at least 2 weeks. Well, I just don't feel like I need to go to a doctor just to prevent something.
Right.
If I'm feeling good. Now, if I start feeling bad, then that's a different story.
What would you advise to other people your age or just other people on how to live healthily?
Well, I don't do some of this stuff myself, and I know that it should be done. More exercise. I still work.
Yeah.
I'm 83 and I still drive a combine. Do all, sit there for 6 hours straight. And I figure getting up and down, walking like that, it's still getting me exercising.
Do you think doctors have changed over the past 20, 30 years?
Yes.
How have they changed, do you think?
Well, I don't know how, but I mean, they're just more, they rush you too much and they're, well, I don't know. Yeah, some of them aren't, some of them are.
Do you have anything specifically that you would like in healthcare to change? Anything for the better for rural health?
More education.
Do you think more patient education would be beneficial?
Yes.
Yeah.
You're wrong. But I remember the days when we were having our children with the family physicians back then. And if, like one time, one of the boys had measles or something, and Dr. Manley from down in Clarksville said, don't bring him out. I said, I'll come up here. So he come up to the house. You wouldn't hear that anymore.
That's true.
No,
And that actually leads me to, how do you think healthcare in the rural area has changed over the past 50 years?
It's just got more, I don't know, just, it's not personal like it used to be. I don't think. You still have I consider Clarksville a rural area, you know, small.
Right.
They still communicate, know you by name and all of that, communicate, but it's not as like it used to be.
They prescribe stuff too quick. A lot of it. I know from experience.
Do you think that could be improved with listening to your patient more?
Got to do what?
Do you think that could be improved with listening to your patient more and not being
Yes.
rushed?
Yes. Not just up and say you did take this because I was over medicated.
Yeah.
my first trip to the doctor that I can ever remember was right down here in Hartman. And there was the barber shop, and in the back room of the barber shop was the doctor's office. And it was Dr. Guy Shrigley, who was a big doctor at Clarksville. That's where he started his practice, down here at Hartman. And I was out one morning stacking up grass in the garden out here, and Dad and I, and my sister called us to come and eat dinner. And I was barefooted and I had a pitchfork, and the grass had covered my feet, and I ran that pitchfork right through my foot, between my big toe and little one there, stuck out about that far out of the bottom of my foot. And of course I went down there, Dad took me down to see Dr. Shrigley. He was there, and of course I'll never forget, he took a wooden, like bigger than like a ice pick, you know, like that, and rammed down through that dang thing to clean it out. You know, and this vomit, boy, they didn't give you an anesthetic or anything like that. It was rough. That was my first time the doctor that I can remember anything.
Is there anything that you think we should be showing to UAMS that needs to be said from
Keep up the good work. Yeah. That's what I would say there. Just keep it up. Do the best you can. And then get out there in the rural area. Become a doctor.